Electronic Medication Administration and Electronic Health Records by Laura Bammett. In 2004, President George W. Bush outlined a plan to ensure that every American have an electronic health record by the year 2014. The enactment of the American Recovery and Reinvestment Act in 2009 by President Barack Obama gave a new direction for the implementation of electronic health records. The use of electronic health records has made a positive impact on the medical field. This slide shows how many areas in the health field that electronic health records impact. Clinics, doctors and physicians, laboratories, radiologists, public health organizations, payers or insurance companies, and of course, the patients. The electronic health records have 8 essential components: health information and data, results management, order entry management, decision support, electronic communication and connectivity, patient support, administrative processes, reporting, and population of health management. Why electronic health records are needed? They provide accurate, up-to-date, and complete information about patients at the point of care, enabling quick access to patient records, securely sharing electronic health information with patients and doctors, providing more effective diagnosis of patients with fewer errors, improving patient and provider communication and convenience, enabling safer, more reliable prescribing, and helping promote legible, complete documentation and accurate coding and billing. The Centers for Disease Control reports that the meaningful use of electronic health records rests on the following 5 pillars of health outcome policy priorities: improving quality, safety, efficiency, and reducing health disparities, engage patients and families in their health, improve care coordination, improve population and public health, ensure adequate privacy and security protection for personal health information. Some key points to using electronic health records to make medication management safer. The Office of the National Coordination for Health Information Technology has identified 6 available and beneficial measures that were not currently being used by many organizations in their processes for ordering medications using the electronic health records. Use specific design features to reduce wrong patient pick list errors, such as using a patient's photograph in the record. Standardize the names of drugs listed in the electronic health record. Implement best practices to organize, design, and configure pick lists, including the standardized drugs being prescribed through the electronic health records. Create a summary review screen that can be viewed before a medication order is completed. Make it easier for ordering clinicians to correct or revise inquired orders, and for the system to track those circumstances as a means to identify areas in which electronic health record improvements might be considered. Provide all patients with lists of their current medications, including a description of why each medication is prescribed to them. Impact of barcode medication. Medication use is a complex process involving medical practitioners, pharmacists, and nurses. It is a fact that medication errors occur in all healthcare settings. Several steps in the entire process, such as transcription, dispensing, and administration, may have potential risks for serious errors and patient harm. These errors may occur due to human factors such as fatigue, the workload, negligence, overlooked information, a lack of knowledge, or a lack of concentration. The use of barcode technology has been identified as a way of improving the administration phase of medication use by confirming a patient's medication at bedside to ensure the 5 rights of medication: right drug, right dose, the right time, the right route, and, of course, the right patient. How it works: upon admission into the hospital, all patients are given a barcoded wristband. Before administering a medication, the nurse scans both the wristband and a barcode on the medication. The barcode medication administration technology confirms that the nurse is giving the medication correctly to the correct patient. If the medication or patient is incorrect, the nurse is notified, thus giving the nurse a chance to correct that error prior to giving the medication. An example of how dangerous this could be occurred in 2007 involving the newborn twins of the actor Dennis Quaid. A nurse accidentally gave the babies 2 powerful doses of heparin, a blood thinner that was prescribed to keep the IV lines open. Fortunately, the babies recovered. It is quite possible that at that time, the use of electronic medication records were not yet implemented at this particular hospital. Some of the short-term effects on practice and client health are no longer having to interpret poor handwriting and handwritten orders, a reduction in the turnaround time for lab results in an emergency department, a decrease in time to administer the first dose of an antibiotic in an inpatient nursing unit. Some long-term effects on practice and client health. In the ambulatory care setting, improved management of cardiac-related risk factors in patients with diabetes, effective patient notification of medication recalls has been demonstrated, and the ability to use the electronic health record and decision support functions to identify patients who qualify for research studies or who qualify for prescription drug benefits offered by pharmaceutical companies at safety net clinics and hospitals. Other effects of electronic health records include a significant avoidance of medication errors because of barcode scanning alerts, a decrease in medical record expenses as a result of going paperless, a decrease in adverse drug reactions through the use of computerized physician order entry. Using an electronic health record flagging function makes clinicians immediately aware that contact precautions are required, for example, MRSA-positive patients. Here are a few unique features of electronic health records. Its ability to integrate all pertinent patient information into one record, regardless of the number of times a patient enters a healthcare system. It includes results of diagnostic studies that may include images, sound and decision support software programs. Because an unlimited number of patient records can be stored within an electronic health record system, healthcare providers can access clinical data to identify quality issues, link interventions with positive outcomes, and, of course, make evidence-based decisions. Some barriers to implementation of electronic health record systems. The Center for Medicare and Medicaid Services list a few challenges and barriers to the implementation of electronic health record systems. They are the technical ability, which is a computer's ability to retrieve and send data throughout the healthcare system, can be affected by its age and location. For example, connecting to the system is more difficult in rural areas. The cost of use. Finding the expenses to invest in training, support, and the physical infrastructure can be a very common barrier. The people. Not everyone will be on board with implementing the electronic health system. Some patients and providers may reject the idea. The training. Implementing a new electronic health record system requires extra training time and resources. The workflow. If the system is not customized to fit its purpose properly, it can disrupt the workflow. The concerns with privacy. Some providers and patients are concerned about privacy due to lost information and cyber hacks. The Academy of Medical Science of Bosnia and Herzegovina cites the following obstacles of the use of electronic health records in physicians' offices. The electronic health records products are expensive and require a major investment. The applications are not standardized. They are more difficult to use than paper-based records. The implementation reduces practice, productivity, and disturbs workflow. The benefits accrue to others such as society and payers, not to providers. Recommendations on how to implement an electronic health record system. Below are suggestions on how to make sure your medical practice avoids a crisis scenario when transitioning to a new electronic healthcare system. System configuration is essential to accurately represent the details of your medical practice. This may involve the creation of clinical templates. It is complex and must be facilitated by technical experts. Enrollment and credentialing. Getting this step right is crucial to ensuring a smooth operation. Training. The best software is useless without staff being properly trained. It is recommended to have all staff trained before the new system goes online. Troubleshooting and risk mitigation. Even with the best planning, problems can arise. Choose a system with a friendly user interface. Include your staff in the decision-making process and assess your practice before implementation begins. In conclusion, after hearing both the positives and the negatives of electronic health records, specifically electronic medication records, I am sure you will agree that despite the aforementioned barriers, the positives outweigh the negatives. Additionally, one would have to admit that they are an asset and a necessity to the medical field in promoting competence and efficiency. The end, and here is the reference slide.